My name is Rachel Burnett, and I will be presenting a presentation on bipolar disorder. I hope you enjoy. Thank you. Imagine waking up one day feeling more motivated and energized than you ever have before. You feel amazing and like you can do anything or everything. However, now imagine that one day, after a week of feeling that great, it ends, and you wake up feeling overwhelmingly sad and depressed and tired. Maybe even so tired that you don't even want to get out of bed because it doesn't feel worth it. For people suffering from bipolar disorder, these mood swings between being high and being low is a reality. As a sufferer of bipolar disorder myself, I am familiar with the struggle that comes with having this disorder. According to the National Alliance on Mental Illness, around 10 million people in the United States alone are suffering from bipolar disorder. Although most of us have a basic knowledge of what exactly bipolar disorder is, it is still seen as a form of depression or a way to describe someone who has mood swings. This misconception comes from the common misuse of the word bipolar and the way it is depicted in the media. Learning from my own experiences with the disorder and what I learned in my psychology class, I know now what bipolar disorder truly is. Upon researching further, I have learned that bipolar disorder is overly diagnosed and severely impacts the lives of those who suffer from it. Today I will explain to you both aspects of the disorder. To begin, we will discuss how overdiagnosed bipolar is. As defined by Mayo Clinic, bipolar disorder is a mental disorder that causes the sufferer to experience extreme mood swings, including emotional highs called mania and lows called depression. When someone with bipolar is experiencing what we call mania, you will feel full of energy and irritable, and you'll feel like you can do anything, and you find that you don't really need sleep. To contrast, when they experience depression, you feel sad and hopeless and tired, and you don't want to get out of bed because nothing feels worth it, even getting out of bed. To be diagnosed with bipolar disorder, you must have experienced at least one manic episode and one depressive episode. Even with such specific diagnostic criteria, bipolar disorder is still overdiagnosed in around 60% of the population, which then raises the question of how is it that overdiagnosed? Well, the answer is actually quite simple. Because bipolar disorder manifests in a similar way to other mental disorders like attention deficit disorder and borderline personality disorder, it makes it easy for some psychiatrists to get confused about which one you actually have. When it comes to borderline personality disorder, the grandiosity that is I don't even know how to explain this. It's a hallmark symptom of borderline personality disorder, this grandiosity. However, it's also a hallmark symptom of mania for bipolar people. So it's not hard for it to be confused. And in the case of people who are suffering from attention deficit disorder, they often will experience irritability and impulsivity, which, like the grandiosity displayed in borderline personality disorder, is often misconstrued as mania, resulting in a misdiagnosis of bipolar when really they're suffering from attention deficit or borderline personality. In attempts to reduce this constant overdiagnosis of bipolar disorder, changes were made to the DSM-V. The DSM-V is the manual. It tells you exactly what the patient has to be exhibiting for you to diagnose them with that mental disorder. Because bipolar kept getting so overdiagnosed, it was added into the DSM-V that you were to not diagnose a patient with bipolar disorder, and if you could find a better explanation from another condition or conditions. Next, we will discuss how severely bipolar disorder impacts the people who suffer from it. It's popular belief that bipolar disorder just affects how you feel, but that's not true. To help you see just how much bipolar disorder alters the sufferer, I'm going to tell you the story of Sally. This is Sally. Sally, growing up, experienced uncontrollable mood swings, which only worsened when she went off to college. After going to college, her mood swings stopped going towards the energized, motivated mania phase and more towards depression and ultimately thoughts of suicide. She was being reckless, trying to do whatever she could to try to numb these feelings that she felt, but she couldn't numb them. Eventually, she decided that the only thing she could do, if she couldn't numb the feelings, would be to stop her feelings altogether. So she decided she was going to kill herself. Before she could kill herself, her friends and her family noticed she wasn't right, and they got her some help. The point is, bipolar disorder, it changes who you are as a person. It impacts the sufferer in such an indescribable way because it changes your mind and changes who you really are. According to a Psychology Today article written by Dr. Michael Pipich, bipolar disorder has become known as one of the deadliest disorders. And the reason is because 20% of sufferers experience suicidal thoughts or attempt and even succeed at committing suicide. 20% doesn't seem that bad. It's only a fifth. That doesn't seem terrible, right? However, when you see it as the actual number, it's a little more eye-opening. 20% of the U.S. population alone is 12,000 bipolar sufferers who attempt to kill themselves because they don't know what else to do, because they feel emotionally drained. This feeling of being drained emotionally leaves the sufferer with this thought that if they couldn't stop the feelings, they would stop themselves being able to feel them ever again. Because bipolar disorder is essentially a disorder that affects the brain, the sufferer is essentially suffering so bad because they are at a war with their mind. To conclude, bipolar disorder is defined by periods of mania and periods of depression, and is one of the misdiagnosed and severe mental illnesses there is. Although commonly misunderstood by people, bipolar disorder is by far one of the most dangerous mental disorders there is. Misunderstood and misdiagnosed, bipolar disorder impacts everybody. And if you know someone who you think is suffering from bipolar disorder or has symptoms that make you think of bipolar, then help them, armed with the knowledge that you learned today. Bipolar disorder is more than just depression, and it's more than just mood swings. If you're going to take anything away from today, it's that bipolar disorder isn't just depression, and it isn't just mood swings. Thank you. Thank you for listening.